I'm going to tell you about our research study that has been published and talk about how masks can be effective to prevent you from COVID-19. My name is Dilek Limmathurasakul, a medical researcher at Faculty of Tropical Medicine, Mahidol University. If you look back in the year 2020, when the COVID-19 had just started the outbreak, it's still unclear and chaos about should you wear mask, should you not wear mask. Even the World Health Organization or WHO, in the early phase, they ask people not to buy mask or wear mask in the public. Why? Because they fear that we will take away the resource or mask from the hospital, so the hospital doesn't have the mask to use by the healthcare workers. Also fear that the people will have a false sense of security, which means that they fear that people will wear masks and not washing your hands or not keeping distance and behave badly. But if you look into Thailand and many countries in Southeast Asia, there are strong recommendations about masks. It's so strong that in March 2020, if you want to buy mask from the drugstore, it's out of market. You cannot buy mask. If even people that queue up to buy super expensive mask to use in their daily life. So it's so important for us as a researcher to develop the research and provide the evidence. One, whether mask is effective. If it's effective, how much? And then, whether we have seen the false sense of security that when people wear masks, they behave badly or not. And whether this should be helpful to guide the national and the global level about recommendation of masks. So, we work together with the Department of Disease Control, Ministry of Public Health, Thailand. We developed the nested case control study. The word nested, it means that it nested in the cohort or a group of the people who exposed to the COVID-19. After they exposed, a proportion developed COVID-19, but a bigger proportion didn't develop the COVID-19 for a set of time. And we asked them back, did they wear mask during that time? Did they touch the COVID-19 patients? How long? About the time that they talk with the COVID-19. Grouping all of those evidence, we published the paper in the Emerging Infectious Disease. And it provides a strong evidence, a level that we should recommend people to wear mask in the public. It can be cloth mask or it can be the medical mask. It didn't see the difference from that. And this provides a strong evidence that even in the public, it can be helpful. We also found that people who wear masks all the time didn't behave badly. Actually, they are the group that behave very, very well. The people who wear masks all the time, keep washing their hands, keeping the distance apart from the other people. What we saw, the people who wear sometimes, didn't wear sometimes, or wearing under the chin, they are the group that behave a little bit not well yet. And that provide the evidence and recommendation to our Ministry of Public Health and also at the WHO, so that they craft the recommendation to strongly recommend wearing masks and recommend everyone to wear masks all the time, not just keep wearing, putting it under the chin or those kind of things, and behave whole set regularly, and that can prevent COVID-19 in our country. This work has been referred by the WHO guideline recommending wearing masks published later. I also take part as an external reviewer on the international guideline from that one. This work has a high impact at both national level and international level. If you want to look further about how this work has been developed and how it has been written, you go to this first link and it will go you to the article. And if you want to look into how people talk about this work, go to the second link. For this one, it will go to the link of called Altmetric, and it will go to the Twitter links, how people tweeted about this article, how the lay people or the general people talking about this. I think that is so important that the research work has a real impact at the global level, guideline, national level, guideline, and also how our people in the society take the recommendation and think further how to prevent themselves from COVID-19. And I hope that everyone can get out from this COVID-19 epidemic soon. Thank you very much.